Question 1. You are tasked with handling a variety of companion animals at a local animal shelter. Among the animals, you are responsible for managing a dog that has shown aggressive tendencies towards other dogs and is exhibiting signs of anxiety. You must determine the most effective way to handle and train this dog for its behavioral issues. Which of the following techniques is most suitable for addressing the dog's aggression and anxiety while promoting behavior? Using punishment-based training methods to correct bad behavior immediately. B. Incorporating positive reinforcement techniques and creating structured routine for socialization. C. Ignoring the dog's behavior and focusing only on its physical health. D. Using choke collar to control the dog's aggression when interacting with other animals. Answer: B. Incorporating positive reinforcement techniques and creating a structured routine for socialization. Explanation: positive reinforcement, such as rewarding calm behavior and reinforcing desired actions, is a well-established method to address aggression and anxiety in animals. By providing rewards such as treats, praise, or toys, you can encourage the dog to repeat positive behaviors. Structured socialization routines help the dog more comfortable around other dogs, and these methods contribute to reducing aggressive tendencies. Punishment-based methods may worsen anxiety and aggression. Ignoring behavior, C, does not address the underlying issues. A choke collar, D, can be harmful and does not address the root cause of aggression and anxiety, potentially making the behavior worse. Understanding and applying behavior modification techniques, such as positive reinforcement, is aligned with the ethical principles of animal care and welfare. Question 2. A client approaches you with a 5-year-old cat that has been suffering from obesity. The client requests advice on managing the cat's diet and exercise plan. Which of the following recommendations would be the most appropriate to ensure the cat's overall health and manage its obesity in a safe and effective manner? A. Recommend drastic reduction in food intake without consulting veterinarian. B. Recommend balanced, portion-controlled diet based on the cat's weight loss needs and incorporate gradual exercise. C. Recommend feeding the cat only wet food to avoid overfeeding and reduce calories. D. Suggest high-protein, low-carbohydrate diet without considering the cat's specific health needs. Answer: B. Recommend a balanced, portion-controlled diet based on the cat's weight loss needs and incorporate gradual exercise. Explanation: gradual approach to weight loss is essential to prevent health complications such as liver disease or nutrient deficiencies. Balanced, portion-controlled diet ensures that the cat receives the necessary nutrients without overfeeding. Exercise should also be incorporated gradually to help burn calories without causing stress or injury to the cat. Drastically reducing food intake can lead to malnutrition or organ failure, particularly in cats, and should never be done without veterinary supervision. While wet food might be part of weight loss diet, C, it alone is not sufficient and can still lead to overfeeding. High protein, low carbohydrate diet, D, may be used in some cases, but it's critical to tailor dietary changes to the cat's individual health needs and monitor progress with the help of veterinarian. Question 3, scenario-based. Mr. Lewis owns a small pet grooming business. Recently, he has noticed a high volume of clients bringing in their pets with flea infestations. After grooming, he realizes that some pets have lice which could potentially spread to other animals in his shop. The situation has become a concern for both the animals and his business. What is the most appropriate course of action for Mr. Lewis to take in order to handle this situation effectively and ethically? A. Continue with the grooming appointments as scheduled without informing clients of the lice issue, as it might be difficult to prevent. B. Immediately stop grooming any affected animals. Disinfect the shop and inform clients about the lice issue so they can treat their pets appropriately. C. Advise clients to treat their pets at home and continue grooming all animals as usual. D. Wait until the situation worsens and then decide what action to take. Answer: B. Immediately stop grooming any affected animals. Disinfect the shop and inform clients about the lice issue so they can treat their pets appropriately. Explanation: Mr. Lewis has an ethical obligation to protect both the animals in his care and the client's pets. Lice infestations are contagious and grooming services could inadvertently spread the problem to other animals in his facility. Stopping grooming immediately for affected animals. Thoroughly disinfecting the premises are essential to prevent further spread. Informing clients allows them to take appropriate action by treating their pets, ensuring the issue is dealt with in a timely and responsible manner. Continuing with grooming, they or advising clients to treat their pets at home without addressing the issue. C. Compromises the welfare of other animals and is irresponsible. Delaying action. D. Could exacerbate the problem and lead to infestations. Ethical and legal standards of animal care require immediate intervention in such situations to prevent harm to animals and protect public trust. Question 4. You are working in an animal care facility and a client brings in a 10-year-old dog that has a history of arthritis. The client seeks advice on how to manage the dog's joint health and ensure it stays comfortable as it ages. Which of the following actions should you recommend to promote the dog's well-being and help manage its arthritis? A. Limit the dog's physical activity and suggest long periods of rest to avoid strain. B. Suggest balanced diet, joint supplements, and regular moderate exercise to improve joint mobility. C. Recommend increasing the dog's activity level to keep its muscles strong and reduce joint stiffness. D. Suggest using painkillers or anti-inflammatory medication without consulting veterinarian. Answer: B. Suggest a balanced diet, joint supplements, and regular moderate exercise to improve joint mobility. Explanation: for senior dogs with arthritis, the best approach involves promoting a balanced lifestyle that supports joint health. A proper diet rich in nutrients, including joint supplements like glucosamine and chondroitin, can help maintain cartilage health and reduce inflammation. Regular moderate exercise, such as walks, can help keep muscles strong and improve joint mobility while preventing further stiffness. Limiting physical activity might prevent overexertion but can also contribute to muscle weakness and stiffness. Increasing activity without careful moderation can strain already vulnerable joints. Relying solely on pain medication D is not a long-term solution and should only be used under veterinary supervision for pain management, in conjunction with other therapeutic measures. Question 5. You are responsible for preparing a large batch of pet food for a local shelter you are working with, a mixture of dry food and wet food to meet the nutritional needs of different animals. While reading the food labels, you come across the term byproducts. How should you explain this term to the shelter manager considering its relevance to the overall quality of the pet food? A. Byproducts are inferior and should be avoided in pet food due to their lack of nutritional value. B. Byproducts are animal-derived ingredients that can provide essential nutrients, but the quality depends on their source. C. Byproducts are always harmful to pets and can lead to health issues. D. Byproducts are not necessary for pet food and are typically used as filler ingredients. Answer: B. Byproducts are animal-derived ingredients that can provide essential nutrients, but the quality depends on their source. Explanation: byproducts in pet food refer to animal-derived ingredients that are not considered prime cuts, such as organ meat, bones, or other parts of the animal. While some may assume byproducts are of low quality, they can actually provide important nutrients like vitamins, minerals, and protein, sourced from reputable suppliers. The key is understanding that the nutritional value of byproducts depends on their source and the quality control measures of the manufacturer. Byproducts are not inherently inferior and they can be an essential part of a well-balanced diet. When sourced correctly, they are not always harmful. C. And they are not simply fillers. D. But rather nutritious parts of the animal, providing valuable nutrition when processed. Question 6. A client brings in a rabbit that has recently started to show signs of diarrhea and reduced appetite. You suspect the rabbit may be suffering from a gastrointestinal issue, possibly caused by an imbalanced diet or stress. What should be your immediate course of action to ensure the rabbit receives proper care? A. Recommend that the rabbit continue eating its regular diet and observe it for a few days. B. Advise the client to immediately withhold all food and water until the symptoms improve. C. Suggest bringing the rabbit to a veterinarian for a full examination, as gastrointestinal issues can escalate quickly in rabbits. D. Recommend giving the rabbit over-the-counter medication to treat the symptoms directly. Question 6. A client brings in a rabbit that has recently started to show signs of diarrhea and reduced appetite. You suspect the rabbit may be suffering from a gastrointestinal issue, possibly caused by an imbalanced diet or stress. What should be your immediate course of action to ensure the rabbit receives proper care? A. Recommend that the rabbit continue eating its regular diet and observe it for a few days. B. Advise the client to immediately withhold all food and water until the symptoms improve. C. Suggest bringing the rabbit to a veterinarian for a full examination, as gastrointestinal issues can escalate quickly in rabbits. D. Recommend giving the rabbit over-the-counter medication to treat the symptoms directly. Question 7. Mr. Thompson owns a small pet grooming business. He has been asked by a new client to groom a cat that has been previously described as having aggressive tendencies towards grooming procedures. What would be the best approach to ensure the cat's safety and minimize stress during the grooming process? A. Restrain the cat firmly and begin the grooming process as quickly as possible to avoid prolonged stress. B. Allow the cat to acclimate to the grooming environment by using gentle handling techniques and take breaks as needed. C. Sedate the cat before beginning the grooming procedure to ensure it stays calm. D. Start grooming immediately without informing the client about the cat's behavioral tendencies. Answer: B. Allow the cat to acclimate to the grooming environment by using gentle handling techniques and take breaks as needed. Explanation: when grooming an aggressive or anxious cat, it is essential to prioritize the animal's emotional well-being. Allowing the cat to acclimate to the environment and using gentle handling techniques such as speaking calmly and moving slowly can help minimize stress. Breaks should be taken as necessary to prevent the cat becoming overwhelmed. Restraint can exacerbate stress and aggression, leading to a dangerous situation. Sedation may be necessary in extreme cases, but it should always be done under veterinary supervision and not as a standard approach. Failing to inform the client about the cat's tendencies D is not responsible, as they need to be aware of potential behavioral challenges before proceeding. Question 8. A dog owner approaches you for advice on training their dog which has exhibited anxiety when left alone. The dog barks excessively, destroys furniture, and seems to experience distress every time the owner leaves the house. Which of the following would be the most effective solution for managing the dog's separation anxiety? A. Ignore the dog's anxiety and allow it to learn to cope on its own. B. Gradually desensitize the dog to being alone, starting with short periods of absence and rewarding calm behavior. C. Punish the dog when it barks or exhibits destructive behavior in the owner's absence. D. Suggest the owner leave the dog with another animal to reduce its anxiety when left alone. Answer: B. Gradually desensitize the dog to being alone, starting with short periods of absence and rewarding calm behavior. Explanation: separation anxiety in dogs is a serious behavioral issue that requires careful management. The most effective approach is to gradually desensitize the dog by leaving it alone for short periods, starting with very brief absences and gradually increasing the duration. Positive reinforcement for calm, such as praise or treats during these absences, helps the dog associate the owner's departure with positive experiences. Ignoring the problem will not help the dog overcome its anxiety and could lead to worsening behavior. Punishing the dog for anxiety-related behaviors can cause additional stress and may worsen the issue, while having another animal present D might help some dogs. It is not a guaranteed solution and may not address underlying cause of separation anxiety. Question 9. You are working at an animal care facility and a dog presents with symptoms such as vomiting, lethargy, and a fever. The dog is not eating and the owner is concerned. Based on your knowledge of animal health, which of the following conditions might this dog be suffering from, and what should be the next step in addressing this issue? A. The dog is likely experiencing a food allergy and should be immediately given a special hypoallergenic diet. B. The dog might have an infectious disease and it should be referred to a veterinarian immediately for proper diagnosis and treatment. C. The dog's symptoms suggest dehydration, so it should be given water and monitored closely. D. The dog is most likely stressed from the visit and should be allowed to rest in quiet area for a few hours. Answer: B. The dog might have an infectious disease and it should be referred to a veterinarian immediately for proper diagnosis and treatment. Explanation: symptoms such as vomiting, lethargy, fever, and loss of appetite are often associated with infectious diseases such as canine parvovirus, kennel cough, or other viral or bacterial infections. Immediate referral to a veterinarian is necessary to properly diagnose and treat the dog. Food is unlikely to cause such severe symptoms and should not be the first assumption. Dehydration could be a secondary issue caused by the vomiting, but it is not the primary concern until the underlying condition is addressed. Resting the dog D does not address the potential for a serious infectious disease and could delay necessary treatment. Question 10. You are working in a shelter and are tasked with socializing a recently rescued puppy that has been extremely fearful of human contact. The puppy displays signs of fear such as cowering and attempting to hide when approached. What would be the best strategy for gradually helping the puppy overcome its fear of humans? A. Force the puppy to interact with humans in a controlled manner to desensitize it to the fear. B. Use positive reinforcement techniques by rewarding the puppy with treats for approaching humans voluntarily. C. Ignore the puppy's fear and allow it to approach people on its own without any intervention. D. Take the puppy to busy public area to expose it to as many people as possible in short amount of time. Answer B. Use positive reinforcement techniques by rewarding the puppy with treats for approaching humans voluntarily. Explanation: for a fearful puppy, the key is to create positive associations with human interaction through gradual exposure using positive reinforcement. Rewarding the puppy for voluntary interaction encourages the puppy to approach humans without feeling pressured. This helps build confidence over time in safe environment. Forcing the puppy to interact could worsen the fear and cause further distress. Ignoring the fear, C. Does not actively address the issue, and exposure to too many people too soon, D. Could overwhelm the puppy and increase anxiety. Positive, gradual exposure is the most ethical and effective approach for socializing fearful dog. Question 11. You are working at a pet store and a customer asks for advice on selecting the best diet for their 8-year-old cat that has recently been diagnosed with kidney disease. Which of the following would be the most appropriate dietary recommendation for this cat? A. Recommend a high-protein, high-fat diet to help the cat maintain weight and muscle mass. B. Suggest a prescription kidney-friendly diet that is lower in protein, phosphorus, and sodium to support kidney function. C. Advise feeding the cat only dry food to help with hydration. D. Suggest a high-fiber diet to promote bowel movements and reduce strain on the kidneys. Answer: B. Suggest a prescription kidney-friendly diet that is lower in protein, phosphorus, and sodium to support kidney function. Explanation: for cats with kidney disease, it is crucial to adjust their diet to support kidney function and prevent further deterioration. A prescription kidney-friendly diet typically has reduced levels of protein, phosphorus, and sodium to ease the burden on the kidneys and maintain proper organ function. High protein and high diets can be harmful to cats with kidney disease as they increase the workload on the kidneys. Dry food, C, may contribute to dehydration, which is problematic for cats with kidney issues. A high-fiber diet, D, is not the best approach in managing kidney disease and may interfere with the absorption of essential nutrients. Question 12. A dog has been diagnosed with flea infestation and the owner is concerned about the potential health risks for both the dog and the family members. Which of the following steps should you recommend to the owner to manage the flea problem effectively? A. Use over-the-counter flea shampoos and sprays for the dog and regularly vacuum the home. B. Treat the dog with a veterinarian-prescribed flea treatment and ensure the entire home, including bedding and carpets, is treated. C. Apply a natural flea repellent made from essential oils to the dog and clean the home with chemical-free solutions. D. Only treat the dog and ignore the environment, as fleas cannot survive in the home for more than a. Answer: B. Treat the dog with a veterinarian-prescribed flea treatment and ensure the entire home, including bedding and carpets, is treated. Explanation: flea infestations require a comprehensive approach that includes treating both the pet and its environment. Prescription flea treatments prescribed by a veterinarian are typically more effective in managing infestations and preventing reinfestation. Treating the home, including bedding and carpet, necessary because fleas lay eggs in the environment, which can continue the cycle of infestation. Over-the-counter flea treatments may not be as effective as veterinary-prescribed options. Natural repellents, C, may not provide sufficient protection or control. Ignoring the environment, D, allows fleas to persist and reinfest the dog after treatment. Question 13. You are responsible for caring for a group of animals in a shelter. One of the dogs, a young and energetic puppy, seems to be overly excitable and has difficulty calming down when interacting with other dogs. What should you do to address this behavior and ensure positive socialization with the other animals? A. Allow the puppy to continue interacting with other dogs without interruption, so it learns how to control its excitement on its own. B. Use positive reinforcement to reward calm behavior during interactions and gradually introduce the puppy to other dogs in controlled sessions. C. Isolate the puppy from other dogs until it shows more control over its behavior. D. Correct the puppy's behavior by scolding it when it becomes overly during interactions. Correct answer: B. Use positive reinforcement to reward calm behavior during interactions and gradually introduce the puppy to other dogs in controlled sessions. Explanation: socialization is an essential part of a puppy's development, but it needs to be done gradually and positively. Rewarding calm behavior and controlling the interactions with other dogs ensures the puppy learns how to interact appropriately. Gradually introducing the puppy to other dogs in a controlled manner helps it build confidence and learn proper social behavior without becoming overwhelmed. Allowing the puppy to interact without any guidance could reinforce undesirable behavior. Isolating the puppy may delay the socialization process and could increase anxiety or aggression in the long term. Scolding may be counterproductive as it doesn't teach the puppy how to behave properly and could harm the bond between the dog and handler. Question 14. A client brings in their 6-year-old dog for a routine checkup. During the exam, the veterinarian notices a growth on the dog's skin that appears to be benign cyst. The owner is concerned but has no experience with such conditions. How should you explain this condition to the owner? A. Assure the owner that the growth is harmless and that no further action is needed. B. Recommend immediate removal of the growth as it may turn malignant in the future. C. Explain that benign cysts are common in older dogs and while they usually aren't dangerous, monitoring for changes is important. D. Suggest testing the growth for cancerous cells immediately to rule out any risk. Answer. C. Explain that benign cysts are common in older dogs and while they usually aren't dangerous, monitoring for changes is important. Explanation. Benign cysts are relatively common in older dogs and they often do not pose a significant risk to the animal's health. The best course of action is to monitor the cyst for any changes in size, shape, or appearance over time, as these could indicate potential problems. While benign cysts do not require removal or immediate action, sudden growth or changes should be evaluated. Recommending immediate removal, B, is not necessary unless there are signs of complications. Testing for cancerous cells, D, should only be done if there are concerns or suspicious changes in the cyst's characteristics. Question 15. A cat has been diagnosed with a severe flea allergy, and the owner is looking for ways to manage the symptoms, which include excessive scratching and hair loss. What would be the most effective approach to treating this condition? A. Recommend using a topical flea treatment for the cat and advise the owner to monitor for fleas, as it may take a few weeks for the symptoms to improve. B. Suggest giving the cat a steroid injection to stop the itching immediately, in addition to treating the fleas. C. Recommend switching to an indoor-only lifestyle for the cat, ensuring no fleas are present in the home environment. D. Advise the owner to use natural remedies such as herbal baths, essential oils to relieve the itching. Answer. B. Suggest giving the cat a steroid injection to stop the itching immediately, in addition to treating the fleas. Explanation. Flea allergy dermatitis is a common and painful condition in cats caused by sensitivity to flea saliva. While treating the fleas is essential, immediate relief from the itching and discomfort can be achieved by administering a steroid injection, which helps reduce inflammation and itching. Afterward, ongoing flea control measures such as topical treatments or oral medications should be implemented to prevent reinfestation. A topical flea treatment alone will help address the flea issue but may not provide immediate relief for a cat's itching. Switching to an indoor-only lifestyle, C, can help reduce exposure but doesn't address the allergy itself. Natural remedies, D, are often ineffective and could cause further discomfort or harm. Question 16. A customer asks for advice on selecting a dog food for their 2-year-old medium-sized dog with a sensitive stomach. They have noticed occasional vomiting and diarrhea after feeding the dog certain foods. Which of the following would be the most appropriate recommendation for this dog? They suggest a high-protein, high-fat food to help with the dog's energy levels. B. Recommend a grain-free food that is easier on the dog's digestive system. C. Advise a prescription diet formulated for sensitive stomachs and gastrointestinal issues. D. Suggest feeding the dog a variety of table scraps and leftovers to add variety to its diet. Answer. C. Advise a prescription diet formulated for sensitive stomachs and gastrointestinal issues. Explanation. For dogs with sensitive stomachs, a prescription diet specifically designed to address gastrointestinal issues is the most appropriate option. These diets are formulated to be easily digestible and often include ingredients that are gentle on the digestive tract. High protein and high fat foods may exacerbate the issue for sensitive stomachs. Grain-free foods, B, may not be necessary unless a food allergy or sensitivity is diagnosed. Table scraps, D, can introduce unhealthy ingredients and inconsistency to the dog's diet, which could worsen digestive issues. Question 17. A veterinarian asks for your assistance in preparing an environment for a newly adopted cat that has been found as A stray. The cat is extremely nervous and hesitant to interact with people. Which of the following steps should you take to help the cat adjust to its new environment? A. Place the cat in a quiet, isolated room with food, water, and a litter box and allow it time to adjust without forced interaction. B. Place the cat in a busy part of the house so it can gradually get used to household noise and activity. C. Immediately introduce the cat to all members of the household to speed up its socialization process. D. Provide the cat with a high traffic area to encourage interaction with other pets and people. Answer A. Place the cat in a quiet, isolated room with food, water, and a litter box and allow it time to adjust without forced interaction. Explanation. Newly adopted or stray cats need time and space to adjust to their new environment. Providing a quiet, isolated room allows the cat to acclimate at its own pace without feeling overwhelmed by the activity of the household. The key is to offer a safe and calm environment, and forced interaction can lead to increased stress. Introducing the cat to high traffic areas B and D or forcing socialization C could overwhelm the cat and delay the adjustment process. Question 18. A dog owner brings their dog in for an annual checkup and mentions that the dog has been licking its paws excessively, especially after being outside. The owner also notices some redness and slight swelling between the dog's toes. What would be the most appropriate course of action? It suggests the owner wash the dog's paws after each outdoor walk to remove dirt and debris that might be causing irritation. B. Recommend that the dog be given an allergy medication to address the licking behavior immediately. C. Advise the owner to schedule a follow-up appointment for further testing to rule out possible allergies, infections, or irritants. D. Recommend using a topical ointment for the redness and swelling and monitor the condition. Answer C. Advise the owner to schedule a follow-up appointment for further testing to rule out possible allergies, infections, or irritants. Explanation. Excessive licking and redness between the toes can be indicative of allergies, infections, or irritants. It's important to have a veterinarian evaluate the situation to determine the cause. Further testing, such as skin scrapings or allergy tests, may be necessary to identify any underlying issues. Washing the aid could help with removing irritants, but it may not address the underlying cause. Allergy medication B could mask the symptoms without treating the root issue. Topical ointment D may provide temporary relief but doesn't solve the problem long term. Question 19. A client brings in their dog for a vaccination appointment and expresses concern about potential side effects. They ask if there is any way to reduce the risk of adverse reactions. How should you respond to the client's concern? They advise that adverse reactions are extremely rare and there is no way to prevent them, but vaccinations are important for the dog's health. B. Suggest pre-treatment with antihistamines or steroids to prevent any potential side effects before the vaccination. C. Reassure the client that vaccines are completely safe and there is no possibility of an adverse reaction. D. Recommend waiting to vaccinate the dog until it reaches a certain age to reduce risk of adverse reactions. Answer A. Advise that adverse reactions are extremely rare and there is no way to prevent them, but vaccinations are important for the dog's health. Explanation. Vaccines are essential for preventing serious diseases in pets, and while adverse reactions can occur, they are extremely rare. There is no pre-treatment that guarantees to prevent reactions, but veterinarians are well prepared to handle any side effects should they arise. Vaccinating pets at the appropriate based on age and health status is crucial. Suggesting pre-treatment with antihistamines or steroids, B, or delaying vaccinations, D, without specific veterinary advice may not be necessary and could delay essential care. Reassuring the client that vaccines are completely safe, C, is misleading as there is always small risk, but the benefits far outweigh the risks. Question 20. A new pet owner is considering adopting a rabbit and asks for guidance on providing the best diet for their new pet. Which of the following would be the best dietary recommendation for a rabbit? A. Feed the rabbit a variety of fresh vegetables, fruits, and a small amount of high-quality pellets. B. Provide the rabbit with a diet consisting mainly of fresh fruits and vegetables with minimal hay. C. Suggest feeding the rabbit only high-quality pellets for a balanced and nutritious diet. D. Recommend feeding the rabbit only hay to ensure proper digestion and prevent obesity. Answer A. Feed the rabbit a variety of fresh vegetables, fruits, and a small amount of high-quality pellets. Explanation. A balanced rabbit diet should consist primarily of high-fiber hay, such as Timothy hay, to promote proper digestion and dental health. Fresh vegetables and fruits provide essential nutrients, and high-quality pellets can be given in moderation to ensure a complete diet. Feeding a rabbit only fruits and vegetables. B. With enough hay can lead to digestive issues and obesity. High quality pellets alone. C. Lack the necessary fiber for proper digestion. Hay is essential for a rabbit's health. D. But it should not be the only food provided, as the diet should be more varied to meet all of the rabbit's nutritional needs. Question 21. A dog groomer is tasked with giving a breed-specific grooming session for a Shih Tzu. This breed requires regular coat care, including trimming and special attention to facial hair. Which of the following techniques should be avoided during the grooming process? A. Shaving the coat down to a short length to manage matting. B. Using a slicker brush to detangle the fur and remove mats. C. Trimming the facial hair carefully around the eyes and mouth using specialized scissors. D. Bathing the dog with a gentle breed-appropriate shampoo before grooming. Answer A. Shaving the coat down to a short length to manage matting. Explanation: Shih Tzus, like many other long-haired breeds, require consistent grooming to maintain their coat. Shaving the coat is not an ideal solution, as it can affect the coat's texture and growth, leading to potential coat damage. These dogs are better maintained through regular brushing and trimming. Using a slicker brush. B. is the right choice for detangling mats, as it removes without cutting the fur. Trimming facial hair carefully. C. is also important, as it helps to avoid eye irritation. Bathing the dog with a gentle shampoo. D. is necessary before grooming to ensure the coat is clean and manageable. Question 22. You are caring for a dog that has recently undergone surgery for a broken leg. The dog is still in the recovery phase and has been prescribed pain medication. What is the most important factor to consider while administering the pain medication? A. Administer the medication on an empty stomach to ensure maximum absorption. B. Only give the medication when the dog is visibly in pain to avoid overmedication. C. Follow the prescribed dosage and schedule as directed by the veterinarian, regardless of symptoms. D. Skip the medication if the dog seems drowsy or less active than usual, as this indicates it is too sedated. Answer C. Follow the prescribed dosage and schedule as directed by the veterinarian, regardless of symptoms. Explanation: when a dog is recovering from surgery, it is crucial to follow the veterinarian's instructions for administering pain medication. Over-medicating or under-medicating can hinder the dog's recovery. Pain medications are prescribed not only to relieve pain, but also to prevent it from becoming overwhelming. Administering medication on an empty stomach is not usually recommended for most pain medications, as it can cause gastrointestinal upset. Giving medication only when the dog is visibly in pain. B. is incorrect, because pain can be masked or managed more effectively with regular doses. Skipping medication. D. based on drowsiness, can disrupt the pain management process, which is vital for recovery. Question 23. A pet owner has asked for advice on keeping their indoor cat engaged and mentally stimulated. The cat spends most of its time lying in the sun and doesn't show much interest in toys. What would be the best recommendation to improve the cat's enrichment? A. Introduce puzzle toys that require the cat to solve tasks to get food or treats. B. Encourage the cat to engage in outdoor walks on leash to provide mental stimulation. C. Use a variety of brightly colored toys to stimulate the cat visually. D. Keep the cat in the sun for longer periods, as cats naturally enjoy sunlight. Answer A. Introduce puzzle toys that require the cat to solve tasks to get food or treats. Explanation: cats, like many animals, need mental stimulation to prevent boredom and related behavioral issues. Puzzle toys are excellent tools for engaging a cat's mind and providing enrichment. These toys challenge the cat to solve puzzles or manipulate objects to access food or treats, helping to stimulate problem-solving abilities. Encourage outdoor walks. B. may be useful for some cats, but it could pose safety concerns or stress if the cat is not accustomed to being on leash. Brightly colored toys. C. can attract cats' attention, but may not provide long-term stimulation without interaction. Simply keeping the cat in the sun. D. doesn't provide enough active enrichment to engage the cat's mind. Question 24. A pet store employee is stocking dog food on the shelves and notices that several bags are past their expiration date. The store manager asks the employee to offer the expired food to customers at a discounted price. What is the best course of action according to animal welfare regulations? A. Sell the expired food at a discounted price as long as it looks and smells fine. B. Discard the expired food immediately and remove it from the shelf. C. Offer the expired food only to customers with specific dietary needs, explaining that the food is expired. D. Continue selling the expired food until it is completely out of stock. Answer B. Discard the expired food immediately and remove it from the shelf. Explanation. Animal welfare and food safety regulations dictate that expired food should not be sold to customers. Regardless of its appearance or smell, expired pet food can lose nutritional value and may be unsafe for pets to consume even if it seems fine. Selling expired food, A, C, D, puts pets' health at risk and is a violation of industry standards. Action is to immediately discard expired food. B. And ensure that all products sold are within their use-by date to ensure the safety and well-being of the animals. Question 25. A dog owner is concerned because their dog has been scratching excessively and they've noticed some hair loss around the ears and tail. After examining the dog, you suspect possible flea infestation. Which of the following should be the first step in addressing this situation? A. Recommend immediately applying flea medication to treat the infestation. B. Advise the owner to clean the dog's bedding and vacuum the house thoroughly before applying flea treatments. C. Suggest that the owner switch the dog's diet to see if food allergies are causing the scratching. D. Recommend using home remedies like vinegar or essential oils to treat the fleas. Answer. B. Advise the owner to clean the dog's bedding and vacuum the house thoroughly before applying flea treatments. Explanation. When dealing with a flea infestation, treating the dog is only part of the solution. Fleas can be present in the dog's environment, including its bedding and the floors of the house. Cleaning the bedding and vacuuming the house thoroughly is essential to prevent reinfestation. Applying flea medication is necessary but should be done in conjunction with cleaning the environment. Switching the dog's diet, C, is not an appropriate first step for flea-related issues. Home remedies like vinegar or essential oils, D, may not be effective and could be harmful to the dog. Flea prevention should always be addressed with proper veterinary-approved treatments. Question 26. You are tasked with administering a first aid treatment to a dog that has been bitten by another animal. The dog is bleeding from a wound located near the hind leg, and the dog seems anxious and agitated. What should be your first step in managing the wound? A. Apply a clean cloth or bandage to the wound to stop the bleeding. B. Restrain the dog to prevent further injury and stress, and then apply a bandage. C. Clean the wound immediately with antiseptic, then bandage it. D. Call the veterinarian and wait for further instructions before doing anything. Answer. B. Restrain the dog to prevent further injury and stress, and then apply a bandage. Explanation. The first priority in a first aid situation like this is ensuring the safety of both the injured animal and the handler. Restraining the dog, B, is crucial as an agitated dog may make the injury worse or pose a risk to the handler. After restraining, applying a clean cloth or bandage to control the bleeding is important. It is critical not to rush into cleaning the wound, C, without first stopping the bleeding. Immediate cleaning may cause more pain and stress, especially if the dog is already agitated. While calling a veterinarian, D, is important. Addressing the immediate bleeding and preventing further harm comes first. Question 27. A client brings in a 6-month-old puppy for its first vaccination. The owner is unsure if the puppy has had any prior vaccinations and is worried about over-vaccinating. What should you recommend to the client? A. Recommend that the puppy be vaccinated immediately, as the risk of over-vaccination is minimal. B. Advise the owner to wait until the puppy shows clear signs of illness before vaccinating. C. Suggest that the puppy be tested for previous vaccinations and then vaccinated accordingly. D. Inform the client that the puppy should only receive vaccinations if it is showing symptoms of disease. Answer. C. Suggests that the puppy be tested for previous vaccinations and then vaccinated accordingly. Explanation. It is essential to confirm a puppy's vaccination history before administering new vaccinations to avoid over-vaccination or vaccine reactions. Testing the puppy's antibody levels or discussing the history with the breeder or previous owner can guide the decision. Administering vaccines without knowing the puppy's vaccination history could lead to unnecessary vaccines, potentially causing adverse effects. Waiting for signs of illness, B, is not appropriate, as vaccination should be preventive rather than reactive. Only vaccinating when the puppy shows symptoms, D, can lead to preventable diseases and health issues. Question 28. A client has been struggling with a cat's behavioral issues, which include excessive scratching of furniture and inappropriate urination outside the litter box. The owner believes the cat may be anxious or stressed. Which of the following would be the best initial approach to address these behaviors? A. Suggest the owner invest in pheromone diffusers or sprays to calm the cat. B. Recommend the immediate use of medication to treat the cat's anxiety. C. Advise the owner to reprimand the cat whenever it scratches or urinates outside the litter box. D. Recommend providing the cat with more toys to distract it from its behaviors. Answer A. Suggest the owner invest in pheromone diffusers or sprays to calm the cat. Explanation. When dealing with behavioral issues like excessive scratching and inappropriate urination, stress or anxiety is often the contributing factor. Pheromone diffusers or sprays a proven non-invasive method to help reduce anxiety in cats by mimicking natural pheromones that promote calmness and comfort. Immediate medication B should not be the choice unless specifically prescribed by a veterinarian after thorough assessment. Reprimanding the cat C can worsen the behavior and lead to confusion or fear. Offering more toys D might help temporarily, but it doesn't address the root cause of the stress. Question 29. You are tasked with giving advice to a dog owner who wants to switch their dog's diet from standard commercial kibble to raw food diet. The owner is particularly concerned about the dog's digestion and overall health. What would be the most important consideration before transitioning the dog to raw food diet? A. Ensure that the dog is eating enough raw food to meet its daily calorie requirements. B. Assess the dog's current health status and consult with veterinarian about the suitability of raw food diet. C. Start feeding the dog exclusively raw food immediately, regardless of any health conditions. D. Only offer the raw food diet if the dog seems to be having digestive issues with its current food. Answer B. Assess the dog's current health status and consult with a veterinarian about the suitability of a raw food diet. Explanation. Before switching to a raw food diet, it's essential to assess the dog's health and discuss the transition with veterinarian. Some dogs may have health conditions that make raw food diet unsuitable or require specific adjustments. Simply ensuring that the dog gets enough calories is not enough to guarantee balanced, healthy. Immediate changes C may lead to digestive issues or other health problems, particularly if the dog has underlying conditions. Offering raw food diet only in the presence of digestive issues D is not ideal, as the diet should be considered for its overall health benefits, not just as a reactive measure. Question 30. A pet care facility has a dog that shows signs of aggression when approached by other animals during socialization. The dog has previously been socialized but is becoming more territorial. What is the most appropriate behavior modification technique to implement for this dog? A. Use positive reinforcement to reward calm behavior when the dog interacts peacefully with other animals. B. Immediately correct the aggressive behavior with a loud noise or punishment to stop the aggression. C. Isolate the dog from other animals entirely until its behavior improves. D. Allow the dog to continue interacting with other animals in a controlled, non-rewarding environment to desensitize it. Answer A. Use positive reinforcement to reward calm behavior when the dog interacts peacefully with other animals. Explanation. When dealing with aggression in dogs, the most effective method is to reinforce positive behaviors and calmness through positive reinforcement. This rewards the dog for demonstrating non-aggressive behavior and encourages the dog to associate other animals with positive experiences. Punishing the dog B for aggression lead to increased anxiety or fear and exacerbate the problem. Isolating the dog C may not be effective as it could increase territorial tendencies and does not address the root cause of the aggression. Simply allowing the dog to continue interacting D without any positive reinforcement or structured approach may not help resolve the issue and could make the behavior worse.